Take notes,
Okay.
guys. Please take notes. Take notes.
Yes. Thank you. Okay. So let's discuss about number 1, active listening. How would you say you are actively listening? You're talking to me and you're writing down something.
Eye contact.
Eye contact. Okay, very good. Intermittent eye contact. 2 to 6 seconds, right? Is that like this? Talking to me like this. Okay. Face to face, right? You're not sitting shoulder to shoulder, right? Do I do this? I lean backward. But do I lean backward? How do I lean to you? Lean forward, a little bit forward, no? Lean for a little bit forward, facing the patient. Okay. Face to face. Okay. What else?
You can
You're
nod.
not-
Nod. You can nod.
Okay. Not a little bit. Okay. Okay. So that's active listening. And guys, it's also in the book, no, to create or to encourage a good patient-nurse relationship or nurse-patient relationship, you have to listen to the patient. Okay? And by listening to the patient, you just keep quiet and elicit. What do you mean by elicit?
To take it in?
Yeah, what's the other word for elicit? Take as much information as you can. You want to encourage them to communicate with you. Okay? That's also in the test, no? So you know how to communicate, no? By asking open-ended questions, right? You want to talk about it, right? How can you be assertive? How can
You're
be
pretty much
assertive?
like directing them, like you're not asking.
Okay, you're not demanding. Okay, you win. Both of you win. You get your way. Patient get your way, their way. Okay, and by using the word I. Okay, remember I told you. Mariam, I need for you to focus and listen. I'm being assertive with respect. It's not like Mariam, can you please? It's not no. It's not a good way or assertive way of communicating to Marian to focus. Let's say she's very talkative in class, no? Okay? Using the word I. Number 3, establish nurse-patient relationship. What again?
You want to make your interaction with the patient as patient-centered as possible, showing enthusiasm, caring towards the patient, and establish a trust between the both of you.
Okay. Okay. So, establish nurse-patient relationship. Okay, so be honest. Listen to them, no? Active listening, no? Because there's passive listening, right? Okay. Closed-ended question. What are these kind of question, guys?
I give yes or no answers.
Okay, yes or no answers, no? So, you know, there will be communication questions here. So,
Word answer.
so this is answered by just a yes or no. Okay. Therapeutic communication, guys. Just always remember, I'm in number 5, no? Just always remember, guys, you just always want to know more. Okay. So you want to encourage them more. You want to talk about it. What do you mean by, right? Please explain why you are anxious taking the test instead of why are you anxious taking the test, right? So when you say please please explain why you're being anxious. Because let's say John told me, John B told me, Miss Joyce, I'm anxious to take the test. Please explain why. Okay? So that is a story coming from John. So she's gonna be blah, 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 blah. And we want that, no? The more you know the patient, the more you can help the patient. No? Okay? So in your exam, you just remember, we cannot ask why, right? We cannot use the word why. You're putting the patient in a defensive mode, no? And then, if Jan told me she's anxious, and I'm gonna say, oh, you know, dynamic quizzing will help you. I'm just like changing the subject instead of focusing on her, what she's telling me. Okay, so you want to, what you call this, validate. You validate the feelings first, right? Because if I just say, you know, dynamic quizzing can help you, I am minimizing what she feels right now, isn't it? Okay, so validate their feelings first, talk about it, about that, and then you turn to other, you know, what can help her with it, no? Okay, explore her feelings. Okay, how do you explore her feelings? By communicating, no? Open communication, okay? Is that what? 7, clarification. How do you clarify a question? A sentence.
We're on 6.
Number 6. What is number 6? I'm sorry.
Hearing impairment.
The hearing.
Oh, hearing impairment. Okay. So what's the first thing you want to do with the hearing impaired person?
Want to face them.
Okay. Because you want them to lip read you. What else? What's the very first thing you want to make sure?
You have
Well,
to
if they
make
have a hearing aid,
so
make sure it's working.
If they have a hearing aid, if it's on, okay. Right? Imagine, no? If you don't confirm it yet, you've been talking and talking, and you can be frustrated, guys, with the no. You really have to have a lot of patience with the hearing impaired person. Okay, so you want to make sure. Do you shout?
No.
Okay. You want to speak in a normal voice. Guys, you might see the questions. Everything is correct. But if you notice, guys, in nursing, what is your priority? Okay?
Patient safety.
Patient safety, no, but we're talking about hearing. The hearing aid is correct. That's it. No? But what I'm saying, guys, you might see, oh, okay, talk normal, sit face-to-face with the client. Which one you gonna do first? You want to make sure there's hearing aid. Okay? Prioritize, guys, ha? Prioritize, no? Number, what are 7? Number 7?
Yes.
Okay, what is a clarification? How do you recognize a clarification communication?
You can, yeah,
Are you asking us, I mean, how to clarify stuff or?
No, what do you, yeah, okay. What is clarification communication? How
Well, I'm
would
thinking that,
you?
I'm thinking that if I don't understand something, like I would ask you, like, could you please repeat the question back for me? And if I have a point that I don't understand, I would ask you to elaborate more about, you know, what the information that you're trying to convey. So,
Exactly.
yeah.
Exactly. Thank you. So you want the patient to explain more. Okay. Giselle, I'm nervous about this test. So you you're gonna communicate with me. What do I mean by nervous, right? So you want me to elaborate. What about? Okay. Just like Jamila said, perfect. Elaborate more. Okay. Let the patient elaborate more. What number? 7, 8. Are we number 8? Okay. What do you do with the patient who does not speak the same language as you? What's the first thing?
Interpreter.
Okay. If there's no interpreter or translator, what's the second one?
Pictures.
You-
Pictures. Pictures to explain instructions. Okay, guys, if you work, let's say, we are assigned in Hollywood. I don't know which part of Hollywood, but it's a lot of Germans. So of course, they're gonna have those brochures or pictures that's in German, or they have pictures that, you know, simple needs like they're cold, they're thirsty, you know, or blanket, no? Okay, pictures. So first, translator, if you don't have it, pictures. Next.
Can you also use family members that are not minors?
I read that it is, but it's the last.
Okay, because
And it also,
that was in the book, but I'm not sure if it's like ATIs.
Actually,
yeah, I read
Cooper
that
book and
too.
ATI is different. Cooper book and ATI is different because in Cooper book it say we can use the family members,
Mhm.
but ATI say we can't use the family members as an interpreter.
Okay, thank you for mentioning that. This
And
has
then-
always,
I'm so sorry, Miss Jimenez. And then it said even we can use just a regular translator. It has to be certified by the building. I mean,
Social worker.
yeah, our social worker. Yeah.
yes,
So-
avoid, avoid family members as much as possible. Yes, it's like a last resort, especially with like critical things like a surgery or something, no? Okay. Okay. Usually guys, sniff and acute have those. Okay, they have it. In the sniff, usually it's the social worker. Okay, that is, if like I work in a Korean population, the social worker is Korean. So that's what we call her for that, no? Okay.
It's like a legal liability, isn't it? In a
Well,
way, let's like in a way. I'm sorry. I don't know. I just started thinking it could be a legal liability because let's say if they didn't translate properly, like you were mentioning, they could turn around and something happened to the patient. They could turn around and sue you and the hospital, you know, or for whatever, you know.
it is, but acute hospital, they have those professionals, no? And they will confirm a lot of things, no? They will.
So the answer should be pictures or social worker.
First is a translator. If you don't have translator, use pictures. Okay. Don't use minor, no? You know, they have their own language. You know, remember, hit me up, holler. I don't know those. You holler. Oh my gosh, I need to go to the internet and what is holler? Okay. Privacy. HIPAA. Oh, Nurse Catherine. You know, my neighbor is your patient. How would you communicate to me that you cannot give any information about your patient?
I would say, I'm
No.
sorry, but I'm following the HIPAA rules and it doesn't allow me to tell you that. Oh, well, actually, we can say sorry, right?
Yeah, no, sorry. But you can be assertive. You see it in the choices, okay? You see it. So remember, assertiveness meaning it's my responsibility. Of course, you don't say it that way. No? Okay, right? It's my responsibility to remind you that we have to respect the patient's privacy. Okay? Your face, okay? No, rolling of eyes, Okay? Okay. So you'll see it in the choices, guys. False reassurance. You shouldn't be communicating false reassurance. Don't worry, everything will be okay. You already know those, right? False reassurance. Okay. Personal zone. Okay. Guys, I've seen this question. So it's gonna ask you, what were you doing in this zone? So what are those zones, by the way? First of all, what is the first one?
6.
There's four kinds of zones, right?
Personal space.
Before that, intimate first. Intimate first, right? 0 to 14 inches. Is it 14 or 18? 18. Right? So what are you what could you be doing with the intimate space of the client?
Like a Foley catheter or
Foley catheter, vital signs, ADS, combing the hair. No, you're not gonna be combing the hair like this with the patient, right? You will be very close, right? Feeding the patient, that is intimate space, right? You're not feeding like this. Okay, so they're gonna ask you about those. So first of all, know the basic concept. What are those spaces that we're talking about, right? If you're left behind, stay after this and we'll talk about it more, huh? Okay, because some have to go to work, guys, okay? So that is your intimate space, 0 to 18, right? Okay, changing a wound dressing. Okay, huh? They said when you're taking a test, chew a gum. So it works, your brain works. This come from Miss Jahaira. Okay,
Take
personal
down
space.
notes.
Personal space. What's the name? The measurement.
0 to 18.
Boy, that is intimate.
18 inches to 4 feet.
Yes. 18 inches to 4 feet. What can you be doing with that?
Explaining.
Okay, talking, explaining, patient teaching, right? You don't have to be in their intimate space while you're talking, right? We're talking about patient, huh? Patient and nurse, okay? Okay. Then
Just to clarify, intimate space is 0 to 18, and then
inches,
okay, in personal space,
18 inches to 4 feet, right? You're talking, okay? Interviewing the patient, right? Okay. So what's next?
Social space.
Social is
4 to 12 feet away from patient.
4 to 12 feet, okay? 4 to 12 feet. There's 4, right? Social, and what's the other one?
Public space.
Public, okay. So social space is like you're making rounds, no? You're making rounds, so it's not within 4 feet, no? Okay, and public space is like you are giving lecture to a group of patients with diabetes, no? You're giving lecture, so you're teaching them in a public space. Next, it's the same, illicit information. This is one of the, to elicit information is one of the ways to build a nurse-patient relationship. So listening and getting more information. So both of those are building nurse-patient relationship. Guys, believe me, if the patient don't trust you, they're not gonna say things. Even we go to our doctors, right? Do you tell the doctor everything? Sometimes we hide, no? It's not about trust, maybe, but maybe sometimes you're shameful, but yeah. And it's hard, guys. If the patient doesn't trust you and you won't get any information, too much information, it's hard. How can you work with a patient like that?
SMS, I think you missed the number 10.
False reassurance, yeah?
Yes.
We discuss about. Don't worry. You'll be fine. You're not sure, no? That's false
Number what is the
reassurance.
next one? Ms. Joyce, please, number what are we right now?
What are we right now, guys? The illicit information of the client. Number 12, right?
Number 12.
Yeah, number 12. If you're lost, stay after class. Number 13. Communication with a patient who lost a family member. So your patient just expired. The family came. What's the first thing you're gonna do?
Say nothing.
Okay?
Let them grieve.
Let them grieve. Give them time to grieve with the family member who expired. Because ATI said, the next patient you have is the family. Okay? If your patient expired, it doesn't end there. They're still in your facility. So the next patient is the family. It's not like you're gonna take care of them, but you still, empathy, no? I think I skip. I'm sorry, guys, no? Number 13. How do you communicate? Communicate about loss. I'm grieving. How would you communicate to me? I'm grieving, guys. How would you be quiet and listen? Yes. Let's let them break the silence. Because if I break the silence, my silence means I'm ready to talk to you.
Miss
Okay?
Joyce, I remember there was a question. I don't remember the question, but the answer was to sit quietly next to them. Is it related to this one?
Yeah, that's the same.
Oh, okay.
Listening is you just sit quietly. You cannot listen when you're talking. Right? So listen attentively, be silent, let them break the silence. That's it. No? Number 15. Are we number 15? 15, Judaism, Jewish. Remember, basic concept, what is their diet restriction? Kosher, very good. So they don't mix what with what? Okay. They don't mix meat and milk. I already asked you guys, no? If you have a tray that has a meat and milk in there, what you gonna do?
Take it back
Where?
to the to the kitchen.
Kitchen and get another one, because serving that, just taking out the meat, because if there's some meat and milk in the diet, it should be the milk first, right? And then the meat. So if you just take out the meat, you already violated their practice. So you have to go back to the kitchen, get another set of tray. Okay? Avoid alcohol, yes. Tobacco, caffeine, correct. Jewish, okay? So they don't eat what?
Blood, like, I don't know.
Pork?
Pork, anything that has scales. Scales, no?
50
Bird-
what kosher?
Birds of prey is Islam. Huh? I'm sorry. What's that?
I said that was 15 kosher, right?
Kosher, yes. Okay. So I think it's gonna have a combination of this and this. Okay. So be careful choosing the correct answer, no?
So I should just make sure Jewish, they don't eat pork or they do?
They don't. Pork, no.
Yeah.
Right, guys? Pork. They eat lamb, chicken, beef, but no pork. Isn't it? Okay.
Please, Mr. Sorry, one last question. Because you said that the quiz will be on like priority of the sequence of the tricky questions because they're all like the same. For the tray and the meat, which one goes first? They drink the milk first or the meat?
Milk first, then meat.
Milk first.
Correct?
Yes.
Okay, thank you.
If there's an order in the diet that has a meat and milk or dairy products, not only milk, cheese. Right? Okay. So let me ask you this, guys. These are your choices. Kosher roast beef and ice cream. Violates Jewish. Carrot sticks and cottage cheese. Macaroni and cheese. Or kosher chicken breast and boiled potatoes. So which one violates the Jewish kosher meal?
I think it was the first one
Why?
because it had meat and milk in it.
Okay. Okay, right? Kosher roast beef and ice cream, it's the same. Ice cream is milk. So that's the one that you choose. I already gave you one. The kosher chicken and boiled potatoes, I don't see a milk in there. So that's okay, right? Okay, be careful in ano ha. Choose very carefully. Okay, how about Seventh-day Adventist? What can you say about Seventh-day Adventist? We're in number 16. What are their religious practices? They're vegetarians. Okay, very good. Oh. Sabbath on Saturday. Thank you, Jacqueline. So are you gonna set up an appointment on a Saturday? No. No, yes. Okay, because it's their holy day. Sabbath is holy day, no? Okay? If it can wait, do it on Monday. Of course, no? If it's an emergency situation, they go. But if it can wait, it says in ATI, right? If it can wait, Monday. Okay, Seventh-day Adventist. Oh, this one, you know, number 17, Chinese tea. What do they believe in Chinese tea? Helps you with what?
Detox?
Digest.
Digestion.
Digestion. No? Guys, you're gonna say, oh, you know, there is for detox, there is for this, there is for that. You just say tea. Don't overthink it. Okay? Don't go beyond your question. It just generally say tea. That's it. Oh, actually, yeah. Hindu. Hindu?
Don't they shower every day?
Okay. Hindu and what else is the, how about the diet?
Cows are sacred, so some of them
Cow-
are vegetarians.
Very good. Cows are sacred. It's not because they eat cows. I searched that in the internet. It's just holy for them, no? Okay. Okay, yeah. Cow. Okay. Don't eat pork. They are vegetarians. Okay, they are vegetarians. So offer them vegetables, no? Don't offer them bologna sandwich, you know. That's why, guys, it's important, no? Look at the chart. What is the religion? Sorry. Okay, so you already know. Muslim. Muslim. What about Muslim? I'm in number 20, and then 90 and 19. Muslim diet. That, I think that's the bird of prey, no?
Don't they pray every day?
Pray every day, 5 times a day, actually. Right? No pork, no birds of prey, because they have to have like how they slaughter or slaughter their
halal when
halal. Yes, thank you, Reina. Halal. Okay, so that's why they don't eat birds of prey. Oh, bless you.
Oh, my bad. I'm sorry.
Okay, it's okay, right? So they don't eat pork. Number one, they don't eat pork. Remember, yeah, in their country, they don't sell any pork. They don't raise any pork. Nothing. No chicharron. No lechon. Nothing. Huh?
What does birds of prey mean?
Like this, you're hunting a duck, right?
Sure. Yeah, I gotcha.
Because it's not how they slaughter their animals. Okay. Oh wait. Seventh-day Adventist, no caffeine, okay? No caffeine. Seventh-day Adventist. So don't give them caffeinated coffee. Okay? You already know the halal. Cultural practices. Let's talk about names. How do you address a Chinese elderly? Harmony, Harabuji? How do you address? Asian. Okay, Asian. How do you address?
You bow to them?
How do you address? Ay, xie.
Chimi chimi.
No, seriously, how do you address? I'm Chinese. How would you call me, Sylvia?
Last name.
Okay, Mrs. Jimenez, Miss Jimenez, right? Okay. By last name, yes, last name. Unless, of course, if I say, you can call me Joyce. It's okay. Post-mortem care for Muslims. How do you prepare them?
You leave the body for the imam to come to say the prayer, and you don't do the taking maybe shower or washing the body. They do everything by their imam, or call it their religious leader.
Okay, so you said that. So I'm a CNA. And I'm ready to prepare the patient's body, to clean the body. What you gonna do?
Wear gloves.
But she said to wait for the imam.
Oh.
Are we call the imam or the family member to be aware of it, or I will stop the CNA from doing the bathing of the body, or else if there is someone that is the same religion that can say the prayer before they have a certain way of doing it, then that person can be in position to do it. That's what the book says.
No.
Not me.
Okay. Okay, remember this, guys. In general, thank you, Linda. In general, you cannot touch a dead body of a Muslim if you're non-Muslim. If you're non-Muslim, okay? Because the body is ritually washed and wrapped in a white sheet or white cloth. Yes, Ryan, I see here. Yes, that's practices, guys. We have to respect those, no? Not to be touched by a Muslim person. Use same-sex caregivers is important to this culture, okay? So you have to intervene with the CNA. You have to intervene, meaning you have to stop them. You have to stop that CNA from doing that, okay? You don't.
Which culture is that one for?
Muslim.
Muslim. Okay, thank
Or
you.
Islam, no? It's the same. Muslim, Islam is the same, correct? Okay. Leave the dentures is okay. Leave the dentures. Disconnect all those tubes, cardiac monitoring, everything. It's okay. Equipments to disconnect is okay. Just do not repair if you are non-Muslim. You can remove the soil drainage. It's okay. Remove it. Okay. Just not the body you're gonna touch. Okay. Okay. Asian American. Oh, what can you say about Asian American eye contact?
Ms. Joy's question for the post-mortem care, what is it only focused on the Muslim culture? Because in for Jewish, it also says that for the Orthodox Jews that someone has to come in and like say a read from the, and then that you're also not able to touch the body
without gloves.
Yeah, and that
cover the mirrors.
for example, if the wife is to pass or like a female in the family, is the men cannot help move the body, so someone has to help with that. Is that also part of this question or just Muslim?
Maybe not in this test, but what if the other test, no?
Thank you.
Yes, you're welcome, my dear. No, guys, okay. Read. Okay, eye contact is disrespectful for Asian American. Okay, so be careful with, because it's it's disrespect. I think also Latinos too, no? We don't. We can talk without eye contact. Avoid eye contact because of disrespect. Okay, 24.
We are 22.
22, oh my gosh, 22? Asian American culture, 22. Oh, yeah, 22, 23, I skipped. Are you clear with 22? So, eye contact is disrespectful. 23, hearing loss. What do you want to make sure of the environment?
It's quiet.
It's quiet. The patient already have a hearing loss, no? Talking to them in the loud environment, it's gonna be both hard for you and of course the client, no? Client. Okay. Mobility. Let's talk about mobility. Bed to wheelchair. Okay. What do you want to make sure? Safety issue.
Wheels are locked.
Wheels are locked. Wheels in the wheelchair. Wheels in the bed. Diba, ha? Okay? Because next thing you know, both of you are on the floor. Because you're gonna assist the patient to stand up, right? Okay? Very important, guys, no? Check the wheels. Bed and wheelchair. Not only wheelchair, not only bed. Both. 3-point gait, crutch walking. What do you understand about the 3-point gait? Weight bear on unaffected, unaffected leg and effective. Weight on one foot. Giselle. Giselle should know this. Giselle?
Oh my gosh.
Come on. Today. What do you understand about 3-point gait? Come on, put it in the chat. Basic concept. When do we use it? When you cannot bear weight on what? Uy, basic concept, guys. Shh. What?
Can bear weight on an affected foot.
Okay.
One of your legs or your foot is affected.
Okay, so you cannot bear weight on one leg, right? No. Non-weight bearing, nothing. That is the use of 3-point gait. How would you teach the patient? Remember, I told you CWS.
You move the crutches first.
Crutch walking.
I remember. Wait, is the crutch the cane?
No, crutch. I'm sorry, crutches.
The ones that go here, right?
Yeah.
Crutches, 3-point gait. Come on, 3-point gait. So, no, I'm sorry. It's not a CWS. I know. That's why you're.
I thought for
confused.
crutches it was divided on the.
Yeah. That's my bad. I'm sorry, Reina. Erase. And not CWS this time. But 3-point gait, you cannot use one leg. So how would you teach the patient? You're gonna move what first?
Crutches. You think of your body like
Crutches
a
and
triangle.
then. Okay. So you're only using
Carry
your
weight
one.
on your arms.
Yes. Okay. Okay. So crutches first, and then your good leg next. Okay. Bear weight on the arms, not on the axilla. Okay. How about 3-point gait? Okay. Crutch walking. Swing through and swing to. What's the difference?
One of them you stop before crossing the crutch, and the other one you cross the crutches.
Okay. So the swing through is you go way past the crutches, right? And the swing to just in front, just not in front. Level of the crutch. Okay. Okay. Can you use some other else's crutches? Can you borrow? No. It's customized for you guys, no? Okay. Make sure the tips are good. You know, there's a rubber tip, right? At the end. Make sure that you check those, no? Check the rubber tip. Can you please add to your study guide the cane walking? Coming up. Cane walking, guys. So how would you, where do you hold the cane? Affected, unaffected?
On the unaffected. And then
Unaffected, no? Okay.
and then you put the crutch and then
It's
Then
can.
affected,
and then the affected.
unaffected.
Cane, weak, strong. What is that can? Cane affected and non-affected. Okay. Okay, good. I have CWS. It's okay. That's good. Number
29.
Are we on 29? 29.
29, I think.
It's
the one before ambulance patient. What do you want to make
Yeah.
sure of? I don't know what that is.
The strength
Before
of,
ambulating patient, what do you make sure of with the client?
the strength of the patient.
Okay. Mr. Luis, are you feeling strong today? Is that how you check? Okay. You know what I'm talking about if you were listening that day. Let me get my Barbie dolls.
Pedal
For
pushes.
those of you who missed it. Huh? Carla, what's that?
Pedal pushes.
This one, no? Okay, push. And then the other one is like this. You want to make sure they have a strength in the lower extremities, no? Before you stand them up. And before you stand them up, what do you want to make sure you're going to use with the patient to assist you with transferring or having them stand up? Do you hold them in the shoulder? My Barbie dolls. Because this is a dollar store, no? Do you hold them in the shoulder? 1, 2, 3. How?
Gate belt.
Oh,
Thank you. Gate belt. Transfer belt or gate belt is the same. Transfer belt or gate belt is the same. Yes.
I'm sorry, that's what happened to the
give
arms
them
of the
time.
doll.
What? Both of you were speaking. I didn't understand anything.
No, I was just saying, give them time to adjust to their air. So sit them up slowly before actually moving them.
Mm-hmm. Oh, okay, because of the orthostatic hypotension. Okay. Those are, no, even though it's not gonna be maybe in this exam, but you're gonna need those information. So don't just focus on what I'm saying, no. This is just assistance for you. Thank you. Okay. Assisted fall. If the patient starts to fall, what you gonna do?
Help them fall.
Okay. Help them fall. By what?
Putting them on the ground.
Okay, sliding them slowly on the ground using your legs, no? Right? You're gonna advance your good leg and then slowly slide them down so they don't go boom. Okay? It's still okay. Yeah, right? Okay? Okay. Body mechanics. Body mechanics, guys. You're lifting a box. So, do you remember those when you're lifting a box? What are those? How do you squat? Okay, squat meaning bend on your hips and knees, not on your back, right? Okay. Lift twice, okay. Mentally first, okay. Do I need the dolly or can I just, okay. Wide stance to broaden your base of support, BOS, right? What else? So if I'm carrying the box, do I carry like this? What? No twisting, okay. Face
To your
face
body.
what you are. Huh?
Close to your body, you carry it.
Close to your body as possible, no? Because if this, you're gonna strain your muscles, no? Okay? Use your large muscles. And if you want to have six packs, use your core muscle. Okay? Always
Then you have to go
contract your abs. Huh?
Oh, yeah, no.
Ay, wait. Let me just mute.
No, I don't need it.
Mute. Okay, unmute yourself if you want to speak. Okay? Hold the box as close as possible when you lift it. Okay? Don't bend on your waist. Hips and knees, okay? Good. Next.
Miss Joyce, that doll is terrifying.
I know.
It's scaring me. Can you?
I know I hope I hide this too because it might give me some nightmare.
Yeah, it's giving me a panic attack. I'm done.
Okay. Okay. Range of motion, guys.
Please. Chapter what? I'm sorry. Number what, please?
Number 1?
Number what are we right now?
Oh, I'm sorry. Range of motion 32.
Okay.
Range of motion, guys. These are your neck flexion, neck extension, hyperextension. You have to review this. It's in words. Okay? Let's say, like what I said, somebody, a Filipino calling you. Psst, psst, psst. You do this. What is this? You don't do this, right? You do this. What is that?
Lateral?
Lateral rotation. Okay? In your test, I don't think the proctorio will flag you for that. If they say, okay, your patient is trying to reach on the other shoulder. So what is this? Okay? That's how it's gonna used to be. Patient is supination. Supination is how? It's like you're holding a soup. Pronation, supination. Pronation, supination. This one you have to study, guys. Because if I give you this, I'm going to give you the answer already. It's not really that hard, guys. Why do you warm up before you exercise? Because we're talking about mobility. So this is also.
The chance of being injured.
Okay, to avoid injury, you have to warm up. And then you also have to cool down, right? Cool down is also a light exercise. Okay? Like what I did yesterday, I did the Zumba. Tonight, I'm gonna do the hip hop Zumba.
Is that 33? You warm up before exercise?
Yeah, to avoid injury. A little bit of stretching, no? Stretch your Achilles tendon, your hamstrings. Okay? So, please know your range of motion, no? Okay, there's two kinds of range of motion. One is active, one is passive. What's the difference? Active is what?
Patient doing it?
Patient is doing it. Okay? I am actively flexing my elbow without your help. Passive is what?
Nurse and
Nurse is there.
Okay, nurse is assisting. Do you do like this? Okay. Mrs. Lillian, let's flex your knees, flex your hips. You're gonna do this? You're gonna hold like this? Where are you gonna hold the patient? If I'm flexing the patient's elbow, knees, what? I'm gonna hold here and below the joint, right? Okay, of course she's gonna do this, I'm sorry. Okay, so I'm gonna hold the joint, I'm gonna flex the knees, okay? Or like
Ms.
this
Joyce,
too, you can do this
can you
too.
show us how to help with the patient's arms next?
There's
Excuse
no
me.
arms, no feet. I told you guys, be a teacher is lots of fun every day, every day. Okay, support the extremities and the joints below. Okay, so if I'm gonna support my patient here. If I'm gonna flex my elbow, right, the patient's elbow, I'm gonna hold her here, and I'm gonna hold her here. Okay. Okay. Or if I'm gonna do this to the shoulders, I'm gonna do this, and I'm gonna hold her here. The extremities above and below the joint. That's an answer already, guys. You already have two. Okay. Aquathermia. It's a heat application. What do you want to monitor if you will apply that to me? Hmm?
Chill.
Circulation.
With heat, make sure you're not dizzy. Aquathermia that's correct, no? Because I can have a dilated blood vessel, so I can be dizzy. Okay, but aquathermia is like a pack. I don't know if I have a picture. Hold on, guys. Let me show you the aquathermia.
Like a heat pad?
Something like that.
Oh, is it
Some
when you
kinda.
put like a piece of cloth or like a towel underneath it so they
Oh,
don't
this
burn?
one, yeah. Okay, this one, just to give you idea, no, this one. This one. This one. This is aquathermia pad. It's a heating pad, no? So what do you want to monitor on my skin?
That it's not burning you?
Yeah.
Okay, very good. So what will you see if it's burning me?
Redness.
Redness, that's it. Redness. So if you see it, stop it. Okay? Stop the treatment if you see redness. Bed positioning. With enteral tube feedings, how would you position the bed?
High Fowlers.
Not high.
45 degrees.
30-degree angle.
Semi. Semi-Fowlers is
30?
15 to...
No, semi-Fowlers is 15 to 30. Yeah. Fowlers is 30 to 45, and
high Fowlers
is until 90, right? 90 is when you are inserting the G-tube, NG-tube, right? But it's already there, so you're gonna put them in the semi-Fowler. It's like 30 degrees is a semi-Fowler, okay? What is the orthopnic position?
90-degree position.
Putting your head on the table like that.
When you're standing erect
You
with
put your head
Mhm.
on the table, resting your head on the table.
Like this, yeah? Tripod position, right? Tripod. You put the patient will put the arms like this on the table, because it will expand the lungs, no? Okay, because if you do this, your rib cage is opening, no? Okay. Greatest risk for a client who is immobile.
Bed sores.
Pressure injury, no, or ulcers. Pressure injury or ulcer. Very good. Before you transfer again, what do you also want to make sure about the patient? We already mentioned the strength. What else do you want to make sure?
The strong side.
Strong side. What else?
To non-skid shoes.
Okay, non-skid shoes, that's good. What else?
Make sure that the patient isn't dizzy when they get up, you know,
Isn't dizzy, what else?
steadiness.
Making sure the wheelchair is at a 45-degree angle.
You already said that, yes.
Oh, okay.
Oh, no, not, yeah, but we haven't, but okay.
Ms. Jimenez, what was the question again?
Thank you.
A patient wants you, a patient sitting on a wheelchair wants you to help her transfer back to the wheelchair. What do you want to make sure?
If she has legs,
Of course. What else?
Is it when you put the knee to knee?
Dangling, knee to knee, what else? Gait belt,
Which ones are affected side?
affected side. If I'm your patient for this day and you don't know me, and I'm gonna ask you, Nurse Raymar, can you please help me back to bed? I'm tired, I'm sleepy. You haven't seen me before.
Identify the client and 2 times.
Don't talk to me.
Put her arm around your neck.
The nurse that put him in the wheelchair is the one that has to return them?
Oh, so you're gonna call another nurse?
Introduce yourself?
I'm there already. I can help you, but I want to make sure what? Check that you can move them first, okay? Close. You want to know what is my assist. Can I stand up? Do I need assistive device to be transferred to the wheelchair? Right? Assess my ability to assist. Oh, guys, by the way, when you're in clinicals already, they know your students. They will ask you for a lot of things. Get me a glass of water. Get me a soda. But actually, there may be their diabetes. Okay? You always say, can I check with the nurse first? Not everyone can assist, so you may need a list. Yes, if you need, you know. Okay, guys, review my slides. Some of the questions are there. I take it out from the bank. How do you talk to a child? Sitting
Eye level.
Eye level, okay. That I think that is in my slides, no?
And avoid non-verbal communication.
Verbal communication. Okay. Verbal communication. Okay, guys, review the abduction, the foot, ROM in the foot. What is inversion? What is eversion? Can you write it down? I want you to get what is inversion and eversion? What is that? Hands and wrist. Range of motion of the hands and wrist. What is this? What is this?
Abduction.
Abduction, no? This is adduction. Okay, very good. You know it. I'm just testing you guys. Let me see if I miss some. You hold the cane on your stronger side, right? Okay. That's the test, actually. That's it. We didn't miss anything. Any question? That's it, guys.
Yeah, can you repeat how do you communicate with the child, please?
communication with the child sit at the eye level, right? Anyway, if it's even if it's not a child, they don't
Miss
we
Joyce,
have to communicate eye level. Yes. So you
Miss
don't
Joyce, can you
overpower.
can you go over the range of motion for fingers again, please?
Abduction, adduction, wrist flexion, extension, hyperextension. Guys, extension, I'm sorry, extension, hyperextension. Hyperextension, guys, if you go beyond the range of motion, you're limber, right?
No, because on the
Oh.
on the guide for finger, it says flexion, extension, hyperextension, abduction, adduction, and opposition for fingers. That's opposition, right?
Okay.
Adduction is bringing them back. Abduction is bringing them out.
AB
What is-
adductions, almost the same.
And what about extension and inflection? Oh, okay. Thank you.
Flexion would just, the easiest way to remember is like make a fist.
Yes.
And then extension is just like a regular laying out your hand.
No caffeine for Seventh-day Adventists. Mostly they don't do caffeine. No? That's it, no? That's it. 8 o'clock, guys. I'll see you. Back in first.
Mistress, I have a question. So can you repeat one more time the assisted fall?
Assisted fall, you have to what you call this, bend a little bit your knees. So you want to broaden up your base of support also. Bend forward, one leg forward, you bend the knees, and then you sit them in your good leg, no? Not good leg, like let's say a dominant, no? Because dominant is the stronger one. You slowly slide them down to the floor with your leg. So if they're about to fall, they just don't gonna be falling straight to the floor. You are easing them down to the floor with your leg. Thank you guys for your for your time.
I'm so sorry, Mistress. I have another one.
Oh yeah, of course. I'm just saying thank you because some of them are leaving.
So the unexpected death is the same thing that you're doing whenever the patient like losing the loved ones is the same. Because
I'm sorry. What's that again?
Question, I don't know, it's a 13, 14 because my number is different. Communication about the loss of a loved one. And there's another one, unexpected death. Family came in. What do you do?
Okay, when there's if I'm grieving, I'm crying, you be quiet and listen. Let me cry or whatever, and then when I break my silence, that's the time. That's your cue that I'm ready to talk. For the patient who just expired and the family came, the first thing you want to do is give them time to grieve with the family. That's not time for you to talk to them. Just be quiet, lead them to the patient, the expired patient, and give them time to grieve. Because in ATI book, even though your patient expired, the next patient is the family.
Yeah. And so another one is, how would you identify false reassurance? I missed that one.
What assurance? False assurance?
False
reassurance. Yeah, the things that you gonna say. Don't worry, you'll be fine. It's gonna be okay. You're not sure. Or hey, I'll call you next. No, don't leave.
You're gonna...
Correct?
Sorry, I was taking the note. And the last one, the Chinese culture in dietary, is it the same thing with Chinese Americans? With Asian Americans, sorry. Yeah, same.
Chinese, yeah.
Okay, I'm done. Thank you so much.
You're welcome. Jorge.
Yeah, I totally forgot to clock out and I can't clock out anymore.
Honestly, me too.
I'm gonna go loca.
Yeah, me too.
Guys, no, that please, guys, I'm
I think when I clocked in,
I'm
it
the
said 8
number
to
one
2.
teacher who keeps on fixing your time, guys. Come on, work with
I'm
me,
super
guys.
sorry about
I
that. I
don't
won't have.
remember. I don't remember.
They
I
set
like
an alarm, no?
pick
Hello.
out.
Yeah, no, I said 8 to 2. That's why I just left it like that.
That's tomorrow.
I didn't see it.
Carla, you're next. Varga, Sylvia, sorry, Sylvia.
I didn't get number 23.
Hearing loss. You're talking to a patient who have a hearing loss. What do you want to make sure of the environment? Carla, Sylvia, are you done? I'm sorry. Sylvia, you're good? Carla, me dear?
I have a question, not necessarily pertaining to this, but just about our agenda for week 6, the comprehensive check that's on there that says for chapters 10 and 11. That's a quiz you're going to give us, right?
Hold on. I guess too much
Because
paper.
it reads different than the comprehensive check 2 where we did the dynamic quiz. So I figured you're probably giving us a quiz that's 10 questions long.
Yes, that's a quiz that
Okay.
we're gonna take in the class. Oh,
Okay.
that's already next week.
Yeah.
Oh my gosh. So we're gonna review again, okay? Don't worry, guys. Next week we're gonna review. I'm gonna give you tomorrow. I'm gonna give you the study guide. Okay. Oh yeah. Okay. 10 and 11. No, yes.
Sorry, Ms. Joyce. I also have a question for the
Yes.
and fundamentals online practice. Is that
Mm.
an exam?
That is an exam we're gonna take on Monday after class because that is preparation already for your final exam.
What
The final exam is 11th week.
What if you don't have class on Monday?
You come on Monday for
Okay.
the test. Yeah.
Okay.
Okay. I will announce, my dear.
It'll be after the anatomy?
Yeah.
Okay.
Probably 1 o'clock because we don't have a retake on Monday. We have an actual test. Yeah. 1 o'clock. It's okay. 1 to maybe an hour, 60 item question. So don't be surprised, guys. Some of the questions we haven't even talked about because this is already preparation for your final exam. That's it.
Where did you say we can find these questions that you gave us today?
In the slides. You know, I posted another set of slides. The combination of fundamentals and ATI. Some of the questions, I think it's there. Because I took it out from the test bank. And I don't know if the Kahoots. I don't know if it's already also in Kahoots. Yeah. Practice, guys. No.
What's the name? What's the name of those slides?
Slides 2.
Slides
Oh. Is it? What's the name of the slide? Hold on.
I don't see them.
Guys, I didn't know you did the survey last week. How was it? Did they ask you about the class? The title, Sylvia, is FON Cooper ATI Slides. It's in Canvas. Let me know if you don't have it. I'll email it to you. What happened to the survey? Is it about the class? I don't want to ask what you put there, guys. Anyway, they're gonna let me know. They
I said
always
that.
let me know.
I said the proctor has a terrifying doll that if she took away the doll,
That's the first time you saw my
that
Barbie
thing is
dolls, no?
terrifying. Burn it. Burn. I'm gone. I'm gone. That's it.
I didn't know. So somebody told me. So it's good, no? Raymar, you have question, my dear?
Yeah. For the extra credit question, how many points was it?
I'm still thinking. Carla, how many do you think? Carla is my consultant.
I think at the very least, this should be the same amount that we did for the key terms.
3. Sounds fair.
3? Okay. Let's see. I'll see.
The credit?
I'll check, okay? Because I call you for for participation. So yeah. Good. Okay, guys, I'll see you on.
I was gonna say 25, but it didn't seem like it was gonna be doable.
Carla, you don't need 25. Yeah. I think I can go max with 3. Okay? Is Manny still here? You know, only half of you attended this review. I hope they pass. Okay, that's it. Thank you guys for your time. I appreciate it. Oh,
I have a
Soledad.
question.
Yes.
You said that for the tutoring for the math, it was gonna be this week?
Every week until the test. Your test is 9th week. I heard Mr. Topper and
oh, he's doing it?
Yes, in campus. I can do it too, guys.
Lab.
I can do it in the thing too. We can practice because I can teach you fundamentals math. Guys, the math exam is not all computation. You also have fundamentals math. We can help you with that too, okay? I'll show you where you can practice.
How are we supposed to use paper and write if we're gonna get yelled at by Proctorio for looking?
No, because you're gonna do this. That's what the students say, no? So it's gonna be blank, of course, no? And then when you're done, you're gonna destroy it. That's what they say. The students say.
Okay, so we don't have to turn it in like the HESI?
No.
Miss Joyce, and the makeup skills, will we actually be like redoing the skills, or are we just gonna do like homework for those hours?
If I'm the teacher, you're gonna redo the skills for me because you miss skills, you're gonna redo the skills. So I don't know with Dr. Emma, but it should be that way. Yes, there is extra credit. Oh, I didn't announce. I'm gonna post a question in Remind, and that's an extra credit for tomorrow.
And
Shortly
we
after
put it
this.
on Remind.
What? Extra credit again?
Remind.
Okay.
Well, I love giving extra credit. You know, don't tell them.
I need every credit I could get.
No, I mean.
Sylvia is not allowed for the extra credit.
Yeah, why not?
Yeah.
I think it makes up for you playing with our emotions last week, Mr. Topper.
Right? I'm gonna post one. I'm gonna post a simple question that requires simple answer.
I'm still waiting on that teaspoon to the ring.
Oh my God, 1 teaspoon is 5 ml. 1 tablespoon is 15 ml.
Term 2? Oh my gosh.
Did everybody do the extra credit, Ms. Joyce? Or did people not respond?
More than half. But sometimes I don't want to say anything. I might say something negative. I don't want to be negative with you guys, but yeah, more than half.
So
mostly the people that doesn't even need it. Those are the one responding.
Miss Joyce, you said you sent something to Canvas? You sent it already?
No, it was on Remind.
Not yet, in Remind. I'm going to post it in Remind, yes.
Make sure you download the app and register with the code so that you get them. You can also get it via text message if you don't get, and then just reply through the app and then you'll get your credit.
And definitely turn on your notifications or put it through text, because sometimes if you are not paying attention, you might miss that it posted and then you won't see it until after it's already been too late and then you can't submit it.
So 2000 means 8 p.m., right? I thought it was 2 a.m. I was like, what the heck? I can't see. I'm going crazy up in here. I'm so sorry. Carla, I have a question, sweetie. So going back to the question from earlier, I heard you say something about writing something down. Where do I find that again? I'm sorry. Maybe I'm hungry.
Which one?
You said somebody's asked you something and you say, yeah, just write the answers down, like handwritten something. What was that? Something that we gotta turn in today?
Oh, I think
Well,
that was when I
things
asked
that-
about the nutrition redo thing.
Oh, but what is that at? On nutrition canvas or ATI?
So it just depends on what you're asking. So the homework that was due today was those chapter tests that she gave us. So
Okay.
chapters 5 through 10. Those
Okay.
are due today.
Okay,
So that's
I
the
can-
homework.
And
So
the
if
other
that's
one?
done, you don't have to worry about that. If you have to retake the nutrition test because you didn't pass it today, then you'll have to handwrite that form, which is the concepts form, and you'll do it through the review topics. You pick one and do your form so that you're allowed to retake the test.
The review topics are from the exam we took today.
Correct.
Oh, so I only pick one, that's it.
Right, Ms. Joyce? Just one? That's all they need to do for the retake?
For nutrition?
Yeah.
No, you just gonna
One review topic, right?
No, you just gonna answer the topics for review. Here, let me show you. Let me
This
show
is
you.
50 questions. I'm lost. I am so sorry.
No, it's okay.
I feel
It's
like
okay. No, it's okay. Wait. It's really confusing. No, it's a lot of things. So no, you're not crazy.
Thank you.
Yeah, it's really a lot of things, guys. If I'm a student too, I would be confused myself. Hold on.
I tell my kids,
You know,
go to
younger
school-
people, they,
go to
yeah.
school before you have kids, because then it gets complicated.
Younger people, they usually easy to,
Yes.
catch up, but us, this one, my
Yeah.
dear, you have this, right?
Yes.
Yeah, that's the one. This is the one you're gonna answer it. This is the exam actually, no? Just answer this and you're gonna be submit this and that's it.
Oh, okay. I thought I gotta pick one and answer from everything. Just answer that. Okay.
Yep.
And then send a copy to Remind, right? Or Remind.
Not Remind. Canvas. You're gonna submit in Canvas. And then the what you call this? The study, case study I will post in Fundamentals shortly. Carla, you're gonna be a teacher? You teach with us, no?
I have my eyes set on a NP position at a children's hospital, so maybe not.
That's good. NP? That's good. That's very good. It's almost a doctor. Almost a doctor. Why don't you be a doctor?
I don't know.
What is
That's
NP?
my dad said. Huh?
Almost, yeah. Almost a
What's
doctor.
NP?
Nurse practitioner.
Oh, wow. Nice.
Right? Hey, Carla, my discount, no? If I'm gonna be your patient, free checkup. Oh, no. Free consultation. That's it.
Yes. Happy to. Although I am hoping to end up at St. Jude's. So cancer in children.
Oh, wow.
And
you will major in oncology.
Wow.
My dad is retired, but he's a pediatric oncologist.
You know what, no? I really have
Oh, I'm gonna
respect
put
on
steps.
them because, taking care of children is hard.
Yeah.
They just gonna cry.
It was a very sad childhood.
They just gonna cry. As adults, we can say things. Oh, it hurts here. This is how it hurts. Blah blah blah. The children, you have to really. What do you call that, Carla? You really have to psychologize what they need.
You have to just sort of know their needs before they do.
Yeah.
Predict
They
their
cannot
needs.
express themselves, no? Yeah, oh my gosh.
Carla is
Good for
gonna
you,
be
my
good.
dear. Yeah.
She's young
I
and
hope
she has
so.
the attitude.
Very smart.